Plan for respite for yourself. You need it. You're going to get exhausted. I can't tell you how many times I've had an urgent phone call saying the carer just can't cope anymore, we need something now. It's really key to looking after yourself. I'd be looking for good reviews, consistency, the responsiveness of the provider, the CQC rating, and of course their pricing. It's got to be competitive.
Hello and welcome to Tracey Bolton from UB Healthcare. I just want to start by asking you to tell me a bit about yourself.
Well, I've been working in care since around 2007, various roles, but since 2017 I've been supporting families to find care.
What contact do you have with family members of those who need extra help to remain at home?
It's usually at the start of the journey. I go through what care they need, what sort of support they need, and I take them through the whole journey from beginning to end, find what care they need, and if they've got any questions, I'll answer them as best I can.
Tell me what the common concerns or questions people have when you meet individuals or families for the first time, and what are they struggling with?
Finances mostly. It's understanding how the finances work. It's a really complicated system. If you don't know what you're doing when you first start out, it's key to getting that in place before you start knowing who's paying for the care. I've had people referred from social workers because they don't want to say what assets they've got. And the social workers, you're self-funding. If you don't tell them what you've got, they can't support you. And I've had people who are actually eligible for support from social services, but they just didn't want to say how much money they had to.
What advice would you have for someone organising or planning for care for a loved one for the first time?
Plan for respite for yourself. You need it. You're going to get exhausted. I can't tell you how many times I've had an urgent phone call saying the carer just can't cope anymore, we need something now. It's really key to looking after yourself.
Is there any information or support out there that you think isn't as well known about as it should be?
Plenty. There's loads of support groups, there's dementia awareness groups, Age UK, there's other charities, and services like us, UB Healthcare. We offer a free service to find care.
Within our communities, how can we be better at supporting families who are juggling looking after a loved one along with their other commitments?
Simple stuff. Just offer to pop to the shops, knock on the door, do you need anything while I'm going? Or, you know, do you need to pop out? I'll stay and have a cuppa with your mum while you go and get your shopping. Just the little things make such a big difference.
What 5 things would you look for in a care provider?
I'd be looking for good reviews, consistency, the responsiveness of the provider, the CQC rating, and of course their pricing. It's got to be competitive.
To that, have you seen any bits of equipment that have really helped people around their home to remain in their home?
There's lots of stuff out there. There's the usual handrails, stair lifts, all sorts of the usual stuff that will get fitted, but there are some fantastic apps out there. I've seen an app recently that monitors, so if mum's at home alone or dad, it monitors where they are around the house, and if there's been no movement, they'll get in touch with you, or mum or dad try to get hold of them, so it's really good.
Any final words of encouragement for people out there who are supporting someone at home who is in need?
First and foremost, it would be about the finances. You need to find out who's going to be paying for the care. There's social services funding, there's NHS funding, and you need to make sure that you know who's paying for the care, because if you pay for it yourself, you're not going to get that money back, and it's very expensive to look after somebody, get a carer in place. There is support, help and resources available out there. You're not alone.